Doctors, what is the strangest thing a patient said they had that actually turned out to be true? I'm an OB/GYN resident, and there's one patient I'll never forget. Back when I was a medical student, I met a woman who was kind, funny, and full of life. She was pregnant with twins through IVF, a little older than most of our patients, and had a few mild risk factors, but nothing that really worried anyone. She came to the high-risk clinic one day, and while her test results looked a little concerning, there wasn't anything dramatic. The specialist decided it would be safest to deliver her babies. She took the news in stride, smiling, joking, and even teasing me that she wanted to meet my girlfriend once everything was over. She was calm, confident, and brave. As she headed to surgery, we wished her well. My supervising doctor quietly said something that stuck with me. Sometimes, it's the ones who look perfectly fine that worry me most. The delivery went smoothly, but shortly afterward, she developed a rare and unpredictable complication, the kind that even the best doctors can't foresee. Despite every effort, she didn't make it. Even after years in medicine, I still remember her face and her laughter that day. You learn to handle loss in this profession, but some patients stay with you forever. Next story. I'm not a doctor, but during my mental health rotation as a medical student, I witnessed something that completely changed how I look at psychiatry. We had a patient who was convinced his neighbor was trying to hurt him. He had a long history of mental health struggles, and everyone, including the doctors, assumed this was just another paranoid episode. They treated it as a symptom, not a real danger. A few days later, one of the doctors went back for a follow-up home visit, and this time, there was no doubt. The neighbor was literally trying to break into the house with a weapon. It turned out the patient had been telling the truth the entire time. The man everyone thought was delusional was actually in danger, and no one believed him. That experience taught me something I'll never forget. Sometimes, even when something sounds impossible, you have to keep an open mind, because once in a while, the unbelievable turns out to be true. Next story. Right after university, I spent some time working on ambulances. One day, I was transferring an elderly man with advanced dementia to another hospital. His memory was so affected that he didn't even recognize his own name or his wife. But during the entire ride, he was cheerful and talkative. He told me all about his past, how he used to be an international footballer, the matches he'd won, even that he once owned a business with David Beckham. It sounded so outlandish that I just smiled, kept asking questions, and chalked it up to the effects of his dementia. When we arrived, his wife was waiting there to meet him. She was kind and gracious, thanking us for taking such good care of him. I mentioned that he'd told us about being a famous footballer and his supposed business with David Beckham. She laughed and said, "Oh, he told you that, did he? You weren't business partners. You just met David a few times." Then she paused and added, "But yes, he really was an international football player." That part's true. She went on to explain that he'd been known for his incredible headers, and the doctors believed years of heading the ball might have contributed to his dementia. I'll never forget that moment, realizing that what I thought was confusion had actually been fragments of an incredible life story. Next story. During my psychiatry rotation as a medical student, I met a patient I'll never forget. He lived deep in a rural valley, what locals called a holler, between two mountains. When he came to the hospital, he was experiencing intense delusions. For weeks, he'd been completely fixated on this belief that the mountain behind his house was going to collapse and bury his home. He hadn't been sleeping, just spending every waking hour collecting rocks, branches, and bits of debris, piling them behind his house to protect it from the mountain. His family said this wasn't the first time, and they brought him in because he'd stopped taking his medication and was exhausting himself. After a week or two in the ward, he started to stabilize. The medications were working, he was participating in group therapy, and everyone agreed he was doing much better. We decided it was time for him to go home. When his family arrived to pick him up, they looked devastated. One of them finally said, "We're not taking him home. There's no home left." The day before, there had been a landslide. It completely destroyed the house. I still think about him sometimes. How what everyone thought was a symptom turned out to be a terrifying truth. Next story. When I was 12, I tore the ligaments in my knee and needed stitches. The procedure went fine, except when the doctor went to remove them later. One broke. He told my parents not to worry, that it would dissolve over time. Fast forward 4 years. I'm 16, and I accidentally hit my knee on something. Suddenly, a tiny piece of blue thread pokes through my skin. I could actually see something curled up underneath, and I was sure it was that old stitch finally resurfacing. I went to the doctor and explained what happened. She looked at my knee and said, "No, that's just a vein showing through. Nothing to worry about." But I insisted. I really don't think veins are supposed to look like blue curly string. She numbed the area, grabbed a pair of tweezers, and gave a gentle tug. Out came 2 or 3 inches of perfectly intact surgical thread. She stared at it, wide-eyed, and said, "I have to show the other doctors this." Then she walked out of the room, holding it up like a trophy. I just sat there thinking, I told you it wasn't a vein. Next story. When my daughter was 3, she took a tumble on the trampoline. She let out a strange scream, went pale, and wouldn't let us touch her arm. We lived just a few minutes from the hospital, so I put her in the car and drove straight there. She fell asleep on the way, which honestly made me even more worried. When we checked in, though, it was like nothing had happened. Suddenly, she was full of energy, twirling, giggling, and literally spinning around the waiting room. The triage nurse gave me a look that said, "You came here for this?" but ordered an X-ray just to be safe. Even the technician was laughing while my daughter danced through the hallway. About 5 minutes after the X-ray, that same nurse came rushing back into the waiting area. Red-faced, slightly panicked, and said, "Please stop her from dancing. She's broken her arm, and we're not sure if she'll need surgery." Thankfully, she didn't need surgery, just a bright plaster cast and 6 weeks of healing. Turns out, my daughter has an insanely high pain tolerance, and apparently, a broken arm isn't enough to stop her from putting on a show. Next story. I'm not a doctor, just a patient with a wild experience earlier this year. In January, the side of my face started to swell up. At first it was small, but over a few days it just kept getting bigger. And the pain was awful. I went to my GP and said, "Looks like mumps, don't you think?" He laughed it off and said, "That's not possible. You've had your vaccines." Still, he wasn't sure what was going on, so he sent me to the emergency room. After 5 long hours of waiting, blood tests finally came back. And, surprise, it was mumps. Turns out, you can still catch it even if you've been vaccinated. It's rare, but it happens. At least now I know that sometimes patients are right. And doctors can be just as surprised as the rest of us. Next story. Not a doctor, but this one happened to a friend's little boy. When he was about 2 years old, he came home from daycare and proudly told his mom that he'd stuck an acorn up his nose. She checked right away. Nothing there. She figured maybe he'd just imagined it and didn't think much more about it. Fast forward a year or 2. Around age 3, he started getting constant sinus and throat infections, one after another. 8 rounds of antibiotics in a single year. No one could figure out why he kept getting sick. By the time he was 4, doctors decided to remove his tonsils, hoping that might help. After the surgery, the surgeon came out holding something small and said, "We found the problem. It was the missing acorn, now old, moldy, and lodged deep in his nasal passage the whole time." They decided to leave his tonsils alone. And guess what? The kid's been perfectly healthy ever since. Next story. A few years ago, I had bone replacement surgery on the upper part of my tibia. The doctors fixed it in place with a titanium plate and screws while it healed. One day, I felt a sharp pain and realized something wasn't right. I went to the ER and told the doctor, "I think the titanium plate in my leg broke." He gave me that look, the kind that says, "Yeah, sure it did." He clearly thought I was exaggerating. Then they took an X-ray. When the results popped up on the screen, you could see it plain as day. The titanium plate had snapped clean in half. The look on his face was priceless. Next story. Patient here. And this is one of those stories where the doctor didn't believe a word I said. I had fallen and hurt my arm pretty badly, but the wait time at my local hospital was insane. So I decided to just sleep it off and go to another hospital the next morning. I barely got 3 or 4 hours of sleep, but it was better than sitting in the waiting room all night. When I told the doctor what happened, she said, "It can't be broken. You wouldn't have been able to sleep if it was." I thought, well, that makes sense, and started to relax, thinking it was just a bad sprain. They still sent me for scans, just in case. A while later, the same doctor came back, this time holding 2 painkillers and looking completely stunned. She said, "You must have an incredible pain tolerance, because your arm is broken in 3 places." She then explained that I'd need surgery the same day, and they were already clearing the schedule for it. The look on her face as she apologized and explained the procedure was unforgettable. Next story. I'm a medical provider now, but this happened years ago when I was still in training. I started getting a mild sore throat, maybe a 2 or 3 out of 10 on the pain scale. Nothing serious. I figured it would clear up in a few days, but it didn't. 1 week became 2, then a month. And before I knew it, I'd gone through an entire clinical rotation still dealing with this constant, low-grade throat pain. Eventually, I convinced myself it might be thyroid cancer. I had 0 symptoms otherwise. No fatigue, no weight changes, no sensitivity to hot or cold, nothing. Just this stubborn sore throat. Then I started to feel what I thought might be a small lump when I swallowed. I had my instructors check, but they all said the same thing. "You're overthinking it." Classic student syndrome. After a few more weeks, I made an appointment with an ENT specialist. I told him I was worried it might be thyroid cancer. He scoped my throat and said, "Looks like acid reflux." I told him I could drink coffee and orange juice all day without any issue. There was no way this was reflux. Still, he wrote me a prescription and told me to come back in a few weeks. That's when I said, "If you're not going to do an ultrasound, I'll find someone who will." You could tell he wasn't thrilled, but he ordered the scan anyway. 30 seconds into the ultrasound, he stopped and said, "Well, looks like you're right. My thyroid was full of microcalcifications, a telltale sign of papillary thyroid cancer." He told me I'd need a biopsy the next day. It came back positive. I had surgery the day after Christmas to remove the tumor. It was the size of a golf ball, hidden just under my collarbone. That's why only I could feel it when I swallowed. 3 days later, stitches still fresh, I started my surgical rotation. And the very first case I scrubbed in for, a thyroid cancer removal. Watching that procedure, knowing I'd just gone through the same thing myself, was one of the wildest full-circle moments of my life. Next story. Patient here, and this one took years before anyone finally listened. Over 3 years, I broke the same rib 11 times. Not from accidents or falls. Sometimes it would just happen doing something simple, like reaching for something on a high shelf. Every time, my doctor would tell me, "It's just not healing right. Give it time." But I knew something was off. Ribs don't just keep breaking for no reason. After the 11th break, I pushed again and said, "Something else is going on." She finally gave in and ordered an X-ray. That's when they found it. A mass sitting right on the rib. The biopsy confirmed it was a tumor. Turns out, it had been weakening the bone to the point where it could snap from the smallest movement. I had surgery in 2018 to remove it. I even gave the tumor a name, Adam, before saying goodbye. The recovery was tough, a full week in the hospital, but the operation was a success. It was one of the hardest things I've ever gone through. But today, I'm completely fine, and I've got all my ribs intact. Next story. I was the patient in this one. Back in 7th grade, my little brother and I were riding scooters when I hit a pothole, classic Michigan roads, and went flying. I put my arms out to catch myself and instantly felt the worst pain I've ever had shoot through my right arm, right around my funny bone. I screamed so loud my brother nearly dropped his scooter. The walk home felt like miles, and the whole time I kept saying, "I broke my funny bone. I broke my funny bone." My brother was panicking, I was crying, and when we finally got home, my mom, who's a nurse, by the way, didn't even believe me. She didn't check my arm, didn't call the doctor, just told me to rest, so I sat on the couch for 4 hours, crying and holding my arm, until she finally took me in. They did an X-ray and, surprise, I had actually broken my ulna. I got a cast, pain meds, and a lifetime supply of, well, it wasn't very funny, was it? Jokes, and no, she never apologized. Next story. I was the patient for this one. When I was in labor with my son, the midwife checked me and said I was only 5 centimeters dilated. She took me to the delivery room, got me settled, and then left to grab some equipment. I told her not to go because I really needed to push. She just smiled and said, "You can't need to push yet. You're only halfway there." A few minutes later, I told my mom, "I'm pushing. I can't stop." She ran to get the midwife, who came back looking annoyed and said she'd check again, even though it was impossible. Well, turns out it wasn't impossible. I'd gone from 5 to 10 centimeters in just 10 minutes, and my son was already halfway out. The midwife's face went pale and she yelled for another nurse to come help deliver. Everything happened so fast that my poor baby came out with a tiny bruise on his forehead and black eyes from hitting my cervix so quickly. He was absolutely fine, just very determined to meet everyone as soon as possible. Next story. I was the provider in this one. A patient came in complaining of movement and itching in the lower left part of his jaw, an area without teeth. As he sat in my chair describing it, he suddenly reached up, scratched through his gum, and started bleeding. Trying to show me what he said were wriggling things. To be honest, I assumed it was psychological, something like a tactile hallucination, so I gently suggested a mental health evaluation. But just to be safe, I referred him to an oral surgeon and even made a personal call to make sure they saw him quickly. A few days later, the surgeon called me back. Turns out, the patient wasn't imagining it. They found some kind of parasitic insects under the gum tissue. He healed up completely after treatment, and I learned a huge lesson that day. No matter how strange a story sounds, always listen. If a patient says they feel something, there's a reason. Next story. I was the nurse on shift that night. One of my patients, a woman in her late 70s, kept talking about how her mother, who was upstairs, had passed away the night before. Since I worked in neuro, I was used to confused or disoriented patients. So I just listened, nodded, and gently said things like, "Oh, really? I'm sorry to hear that." After a while, I mentioned it to another nurse, saying, "She keeps talking about her mom dying upstairs last night." My coworker looked at me and said quietly, "That's because it's true. Her mother passed away in the ICU yesterday." I didn't believe it until I checked the records, and there it was, her mother's name on the list in the morgue. I just stood there for a minute. Goosebumps everywhere. Sometimes patients aren't confused. They just know. Next story. When I worked as a tech in the emergency room, a man in his late 30s or early 40s came in. He said he had started feeling strange while driving to work, so he decided to come straight to the ER just to be safe. Based on what he told us, the doctors ran some early tests to check if it might be a stroke, mostly as a precaution, since it's rare for someone that young to recognize it that early. Surprisingly, he really was in the very beginning stage of a stroke, likely within the first 10 minutes. The doctor who took over his care said he had never before spoken with a patient who was still alert and talking before treatment began. Usually, the process from check-in to transfer takes around 40 minutes to an hour, but this time it was all done in about 20 minutes. He stayed completely clear and calm the whole time. Next story. I'm not a doctor, but this happened at my dentist's office. The numbing medicine started to wear off while she was working on my teeth. I didn't say anything and just tried to stay still and deal with it. After about 30 seconds, she suddenly put her hands on my head and said, "The numbing is wearing off. We're done." Then she stopped and scheduled me for another appointment next week. I was completely surprised. I hadn't moved or said a single word, and she somehow knew it had worn off. Later, I found out from other patients that she can somehow sense things like that. It honestly gave me chills. Next story. I'm a paramedic, and this wasn't my patient, but from another ambulance yesterday. It was a boy, maybe around 12 years old, who thought he broke his arm while throwing a ball. He said he heard a sound in his arm and then it started to hurt. What surprised everyone was how calm he was. He sat in the school gym without showing much pain and even climbed into the ambulance by himself. The quick check didn't show anything serious, but they still put his arm in a splint and took him to the hospital. Later, the ambulance team called to see what the doctors found because they weren't sure if it was really broken. Turns out, it actually was. Next story. Not a doctor, but when I was really little, maybe 4 or 5 years old, I decided to put some M&Ms up my nose. I have no idea why. Kids just do silly things sometimes. A few of them got stuck pretty far back, so I told my grandmother. She panicked a bit and rushed me to the emergency room. By the time we finally saw the doctor, the chocolate had already melted from my body heat. The doctor didn't really believe my grandmother's story because nothing seemed to be there. But just to be sure, he used a swab to check, and when he pulled it out, it was completely covered in chocolate. My grandmother was right all along. Next story. When I was about 18, I dislocated my knee for the second time, just by sliding into a booth at a bar. I yelled out from the sudden pain, and one of my friends called an ambulance. But by the time they arrived, my knee had already popped back into place, so they thought I couldn't have dislocated it. Fast forward about 9 years, after many more times of my knees, shoulders, and wrists slipping out of place, I went through a scary moment when one of my breasts suddenly changed shape. That led to a lot of tests, and they finally discovered that my ligaments weren't holding my joints together properly. My physical therapist suggested I ask for an evaluation for Ehlers-Danlos syndrome. When I brought it up, the doctor told me, "You can't have that. Your skin bounces back normally." But I pushed for it, and about 6 months later, I was finally referred to a specialist. Turns out, I really do have Ehlers-Danlos syndrome. Next story. Not a doctor, but here's what happened to me. My appendix had burst, but I didn't go to the hospital until the next morning. When I got there, they didn't take it too seriously at first because I was laughing and joking around. After a few hours of waiting, they did an ultrasound. The technician said she couldn't find my appendix, so she thought that couldn't be the problem. Then she tried another type of scan and found out my appendix had actually dropped below my ovary before it burst. Everything suddenly became very urgent. They got me changed into a hospital gown and started giving me pain medicine right away. When they were rushing to get the operating room ready, I was still smiling and trying to stay calm because I was nervous but relieved that they were finally fixing it. The doctors even double-checked the results because they couldn't believe how calm I was. They said most people would be in much more pain with a burst appendix. Next story. Not a doctor, but my mom's a nurse. So close enough. Back in college, the day before Easter break, I dislocated my knee. It just so happened to be April 1st. Yes, April Fool's Day. Everyone around me was freaking out, but I stayed surprisingly calm. I started giving people directions. One person to grab some ice, another to get my car keys so someone could drive me to the ER. I was a broke college student, so I really didn't want to pay for an ambulance. Of course, someone didn't listen and called one anyway. While waiting, I figured I should call my mom at work to tell her I wouldn't be driving home for break that day. She didn't believe me at all, probably because I sounded way too calm. As I tried to explain that my kneecap was on the side of my leg, definitely not where it should be, the EMTs arrived. One of them took my phone and said, "Ma'am, with all due respect, your daughter's knee needs to be put back into place, and we're taking her to the ER." At first, I tried to refuse the ambulance ride. But once I realized I couldn't get into a regular car without a lot of pain, I gave in. A few doses of pain medicine later, I felt much better about that choice. I ended up in the ER alone. Everyone else had class, or had already left for break. I even texted my mom a picture just to prove my knee was really out of place. The doctors carefully put it back where it belonged, gave me more pain medicine and crutches, pro tip, don't try to use crutches while medicated, and sent me on my way. Luckily, a friend's mom lived nearby and drove me back to my dorm. I lived on the second floor with no elevator, so somehow I climbed those stairs like a champ, made it to bed, and passed out until my parents came to pick me up for the 3-hour drive home. Next story. Not a doctor, but this happened to me once. My appendix had burst, but I didn't realize how serious it was and waited until the next morning to go to the hospital. When I got there, the staff didn't seem too worried at first because I was laughing and trying to stay positive. After waiting for a few hours, they did an ultrasound. The technician said she couldn't see my appendix, so she thought that couldn't be the issue. Then she tried a different scan and found that my appendix had dropped below my ovary before it burst. Things suddenly became serious. They quickly got me into a gown and started giving me medicine to ease the pain. While they were preparing the operating room, I stayed calm and even smiled a bit, mostly from nerves but also relief that they were finally going to fix the problem. The doctors actually double-checked the scans because they were surprised I wasn't in more pain. They said most people would have been hurting a lot more with a burst appendix. Next story. I'm a nurse, and this happened during one of my night shifts in the emergency room. It was a calm night until a man walked in holding his lower abdomen with several layers of clothing wrapped around his waist. He quietly asked if he could see a male doctor. At the time, the only doctor available was female, and he refused to be seen by her. So I asked one of my male co-workers to check on him instead. A few moments later, my co-worker peeked out from behind the curtain looking completely pale. Turns out, the man had been seriously injured after an argument at home. He was bleeding and had to be taken to surgery right away. Thankfully, he made a full physical recovery, though his relationship didn't. Next story. This story is kind of in reverse. My ex-husband suddenly told me one Thursday that he was having a lung biopsy the next day. He didn't have anyone to take him, so I drove him and brought him back to my place afterward to recover. The doctors told me that if anything seemed off, I should bring him back right away. Not long after, he started feeling really sick and coughing up clear liquid. I rushed him to the emergency room. While driving there, my mind started replaying all the small, strange things I had noticed back when we were still married. Little habits and signs that we both brushed off as nothing serious. Looking back, Everything suddenly made sense. When we arrived, a very young doctor came to see us. He looked like it might have been his first year. Doctor: why did you bring him in? Me: I think you should scan his brain. I'm worried the lung problem may have spread. Doctor: we don't even know for sure if it's cancer yet. We're still waiting on test results. Me: I understand, but please, just check. He looked at me for a moment, then agreed. A few hours later, after the scan, we knew even before the final lab results came back. The cancer had spread throughout his body. It was advanced and had reached his brain. The doctor told me afterward that he almost didn't listen, but was grateful he did. They quickly arranged treatment, and everything moved very fast from there. It felt like something out of a movie, unreal and emotional all at once. I still think about that day and how strange it all felt. Next story. My husband had already been diagnosed by a previous doctor, but when we moved to another state, his new doctor didn't believe him. At the first appointment, my husband explained everything: the tests, the scans, and the treatment plan he had already gone through. He even signed a release form so they could get his medical records. He showed the doctor his current medications and asked for refills and a referral. The new doctor agreed to everything except one prescription, saying he wanted to review the records first before continuing it. My husband tried to explain that the pain he was dealing with was very real and constant, like a deep ache that flared up badly at times. He was frustrated because he had run out of the only medication that helped. Finally, in his frustration, he told the doctor, "You can check for yourself." The doctor did, and immediately realized that my husband had been telling the truth all along. The prescription was written that same day, and a few weeks later, the medical records arrived confirming everything. Next story. Not a doctor, but this one definitely fits here. My dad has 3 brothers, and when they were kids, the youngest one always had the worst-smelling breath. It was so bad that no one could figure out why. They saw doctors and specialists, but nobody had an answer. Their family didn't have much money, and all 6 of them shared a small house, 2 kids to a bed. My dad had to share a bed with his younger brother, but the smell was so bad he'd end up sleeping on the floor instead. Years went by like that until one day, when his brother was about 7, their regular doctor finally discovered something strange: a pencil-top eraser lodged deep inside his nose. Apparently, when he was a toddler, he must have stuck it up there and forgotten all about it. It had been there the whole time, slowly causing the problem. Once the doctor removed it, the mystery and the smell was finally solved. Next story. I'm the patient in this story. When I was younger, I had an unusually fast metabolism, so fast that it actually worried my doctor. To give you an idea, over 3 years, I grew about 5 inches taller, but didn't gain a single pound. By the end of that stretch, I was around 5'3" and still weighed about 75 pounds. My doctor sent me to a nutritionist to make sure everything was okay. The nutritionist took one look at my chart and immediately thought something was wrong at home. When I told him how much I ate, he didn't believe me. He even made me keep a food journal and have my teachers sign it at lunch every day to prove I was actually eating. At the end of the week, I went back with my parents, and he reviewed the journal. After a long pause, he shook his head and said, "Well, looks like you really do eat a lot." Then he gave me the funniest prescription I've ever heard. He told me to eat a bowl of ice cream every night before bed to keep up with my metabolism. Next story. My uncle was diagnosed with a condition called genetic hemochromatosis after doctors discovered unexplained liver damage. It's a rare disorder where your body stores too much iron. When that happened, my family was told that all close relatives, including me, should get checked too. When I asked my doctor about it, she gave me a surprised look and immediately wrote me a referral to a genetic specialist. We even joked about doing some old-fashioned bloodletting, which, funny enough, is actually one of the real treatments. Since the issue is too much iron, removing some blood every month or so can help keep levels normal. When I finally met the geneticist, he also seemed doubtful. He told me the condition was extremely rare and that he'd hardly ever seen a case. It even took him a while to find the right testing kit. A little while later, the results came in. I didn't have the full condition, but I was a carrier. That means I only have one of the two genes needed to develop it. The doctor just shook his head and said, "You were right to be cautious." That's amazing. For anyone who's curious, genetic hemochromatosis is a recessive condition, which means you need two copies of the same gene to have it. People who only have one copy are carriers like me. They don't get sick, but their kids could be at risk if their partner is also a carrier. It's more common among people with Scottish or Irish ancestry, and it tends to affect men more severely because women usually lose iron naturally through monthly cycles until later in life. If it runs in your family, it's worth asking your doctor to get tested properly. At-home kits can be helpful for a hint, but official screenings are much more accurate. Next story. Of course not a doctor. But my dad was the patient in this story. He had fallen backward one day and broke a rib. That night, while he was resting, he suddenly told me, "Something feels wrong with my heartbeat." I listened closely, and I could actually hear it. A faint, rhythmic sound that seemed to come from his chest and mouth at the same time. It was unlike anything I'd ever heard, and honestly, it scared me. We rushed to the emergency room. I told the doctors, "It sounds like his heartbeat is echoing or resonating somehow." They didn't think much of it and told us to go home and monitor him. By the next day, my dad started having trouble breathing, so we went to his regular doctor. They did an X-ray and discovered that one of the broken ribs had injured his lung, which had started to fill with fluid. That strange sound we'd heard, his heartbeat echoing, was actually real. Later, I looked it up and found out it's something called Hammond's sign, a rare condition where a heartbeat can be heard through the chest due to air or fluid trapped around the lungs. Next story, patient here. A couple of months ago, I was at a music festival and got caught up in a mosh pit. I went down hard, but someone quickly pulled me out. Afterward, my knee felt really off, so I went to the medical tent. Not once, but 3 times. Every time, they told me it was probably just a bruise and gave me some pain medicine and an ace bandage. I tried to keep going, but after about 6 hours of walking on it, with my knee giving out on me again and again, I decided to head home. The next morning, I asked a friend to drive me to the emergency department. I walked in by myself and waited a couple of hours to be seen. When I finally did, I told the doctor I thought I might have torn my ACL. The doctor brushed it off, saying there was no way I could have walked in if that were true. Well, the scans came back, and it turned out I had what's called the terrible triad: a torn ACL, MCL, and PCL. Basically, 3 major ligaments all injured at once. It meant surgery and a long recovery, somewhere around 6 to 9 months. So, yeah, lesson learned. Sometimes you really do have to trust your instincts when you know something isn't right. Next story. When I moved to Europe, I dislocated my shoulder again. It was about the millionth time. I told the doctor right away that it was out. He didn't believe me and said, "You wouldn't be talking to me that calmly if it were really dislocated." He moved my big jacket aside, checked, and of course it was exactly where I said, "Out of the socket." I've always had a very high pain tolerance, so I stay calm in those moments. But it was funny watching him realize I was right. Next story, I'm not a doctor, not even the patient in this story, just a co-worker of the person it happened to. A few years ago, one of my co-workers came into work not feeling great. He said he felt achy all over and had these red spots on his face. He told us he had a doctor's appointment at lunch because he'd been feeling worse since the night before. Out of nowhere, I suddenly asked him, "Hey, have you ever had chicken pox?" The spots didn't really look like pimples, but something about them reminded me of a character in a book I had just read who had the same thing. He said he didn't think he ever had it as a kid, so lunchtime comes and he heads off to his appointment. About 40 minutes later, I get a call from him. He said the doctor wasn't sure at first what was going on, until he mentioned what I said. The doctor looked at him and said, "That must be one very smart lady, because that's exactly what you have. Chicken pox." And that was my first and only medical diagnosis, all thanks to a random detail I remembered from a book. Next story. I once told my therapist, who I was seeing for unrelated grief issues, about how much stress my fiancé was under at the time and how it was affecting me. They asked me to explain more, so I did. After hearing everything, they grew concerned and suggested I see a psychiatrist, thinking that what I described might sound like I was imagining things or having an overly intense reaction to stress. Fast forward about 3 years, my husband's name appeared in national and international news. He had become a whistleblower in a major federal case against a large corporation and the government agency connected to it. Once that happened, life changed overnight. We started noticing cars following us, news vans parked outside our home, and reporters trying to talk to anyone who knew us, some of them pretending to be friendly just to get information. It was a strange mix of fear and validation. Everything I had said years earlier turned out to be true, but after living through that experience and seeing how easily information can be used against you, I've been very careful about seeking any sort of therapy or counseling since then. Next story. I'm the patient in this story. Back in college, I started feeling really sick for a few days. I was exhausted, feverish, and my lymph nodes were super swollen. So I went to the campus health center. They told me it was probably just a sinus infection and sent me home. The next day, things got way worse. I couldn't even keep down a sip of water and could barely get out of bed. I called a friend to take me to urgent care, and after a quick check, the doctor there told me I actually had the mumps, even though I'd been vaccinated. I had to report it to my school and the health center. But when I did, they didn't believe me. They made me come back in to confirm it. Sure enough, after they tested me, surprise, it really was the mumps. So, yeah, thanks to them not believing me, I ended up having to walk around campus while contagious. Definitely not my favorite college memory. Next story, not a doctor, but this happened when I was a kid at football training camp. I was playing goalie, and one of the senior coaches decided to take a penalty shot. He kicked the ball with full force. I dove to stop it, and the ball slammed into my arm, instantly breaking it. I knew right away it was broken. I'd broken that same arm 3 times before, and you just know when it happens. But the coach didn't believe me. He said, "No way. If it were broken, you'd be crying or rolling on the ground." We went to the hospital, and even the nurse said the same thing. But deep down, I knew for sure. Sure enough, after the X-ray, they came back and confirmed it. The arm was broken again. When you've been through it before, you just know. Next story. Not a doctor, but this happened to me back in 2017. I crashed my four-wheeler going about 40 miles per hour. It rolled over with me still on it, crushing me into the rocks and dirt. A friend rushed me to the emergency room as I was fading in and out of consciousness. They paged every doctor in the ER. I remember at least 10 people standing around me, shouting directions and working fast. Someone even brought in a hospital chaplain to pray with me. I barely remember having my clothes cut off, scans taken, X-rays, CTs, the whole thing. When I started to come around, one doctor walked over and said something I'll never forget. "We saw pictures of your ATV and your helmet. I don't know how you survived that crash. Even more amazing, you didn't break a single bone. You've got tissue and cartilage damage, but that's it. We'll keep you overnight to watch for internal bleeding. but you'll probably go home tomorrow." They kept me for the night, and the next morning, I walked out on my own 2 feet. No internal bleeding, no broken bones, just a ton of bruises and a few months of recovery. My full-face helmet, neck brace, and cargo box saved my life. Without them, I wouldn't be here. Most people don't believe me when I say it, but I survived a crash that should have been fatal and walked away. Next story. Not a doctor, but that's never stopped anyone else here. One day, my then-girlfriend started having terrible pain in her side and stomach. Our roommate suggested we go to the ER because it sounded like it could be appendicitis. So we went, got her checked in, and after about an hour, the doctor came by. He brushed it off immediately and said it was probably pregnancy pains. I told him that wasn't possible. Her period had literally just ended a day or 2 before. He gave me this look and said I was just trying to avoid responsibility. That really made me mad, but I kept calm and went through all of her symptoms one by one until he finally agreed to test for appendicitis. Good thing he did. The test came back positive, and she was in surgery that same night. Throughout the day, I kept referring to her as my fiancée, just so the staff would take me more seriously. The silver lining? After everything we went through, I realized how much she really meant to me. And a month later, I actually asked her to marry me. Next story. Not a doctor, but my mom worked as a surgical nurse at Emmanuel Hospital in Portland, Oregon during the 1990s. She was one of the best nurses there and often picked up extra shifts in the emergency room on weekends to help pay for my medical care while I was recovering from cancer as a kid. One night, a young man came into the ER with a very unusual problem. He was embarrassed and hesitant to explain what had happened, but finally told the triage nurse that he had accidentally gotten a household device stuck where it shouldn't be. Most of the staff thought he was joking, but my mom took him seriously and made sure he got an X-ray. Sure enough, the scan showed the problem clearly. Unfortunately, some of the staff didn't act professionally and were laughing about it in the hallway. I was young at the time and didn't really understand what was going on, but looking back, I still think it was unfair how they treated him. My mom, however, stayed kind, calm, and compassionate. She comforted the patient, made sure he got proper care, and even called one of her trusted colleagues to assist so he wouldn't feel judged or humiliated. The surgery went smoothly, and the man recovered completely. Later, it turned out he and his partner actually lived in the same apartment complex as us, just a few buildings over. They became family friends and even helped my mom by watching me when she had to work long hours. Lesson learned: never judge someone for an embarrassing mistake. You never know what someone is going through or how kind they might be once you really get to know them. Next story. Not a doctor or a patient, but this is something that shaped a lot of my understanding of health. And what happens when it's ignored? Growing up, my mother didn't really believe in doctors or mental health. Because of that, I never got checked out for things that should have been looked into. When I was around 10 or 12, I started having what I later learned were temporal lobe seizures. But at that age, with no real medical knowledge and only movies for reference, I honestly thought I was possessed. It wasn't until I read Lord of the Flies a few years later that I realized what I was experiencing sounded more medical than supernatural. Still, I didn't tell anyone, especially not my mom. She only found out when I was 17. After I had 2 seizures in public, and a paramedic explained what had happened. When I was younger, around the same time those seizures started, my mom began dating a man who everyone at our church encouraged her to marry. She thought it was the right thing to do, to give me and my sister a father figure. At first, he and I got along well, mostly because we had strange conversations about things I didn't understand at the time. He would talk about hearing voices, and I would tell him about what I thought were possessions. A few months after they got married, things fell apart quickly. He disappeared for a while, then started leaving unsettling messages and showing up uninvited. My mom eventually got a restraining order, and that's when I learned he had been living with a serious mental illness that no one had told her about. Looking back, it's hard not to feel like everyone in that situation, me, my mom, and even him, needed help and understanding that none of us had access to back then. Next story. I was the patient in this story. I had a rhinoplasty done and was sent home with some pain medication. At first, everything seemed fine, but about 6 hours later, I was hit with the worst pain I've ever felt in my life. It felt like my entire face was under pressure and burning from the inside. My mom called the doctor, who told us to go straight to the ER and ask them to give me a different kind of medication if needed. When we got there, I could barely stand the pain. We told the nurse exactly what my doctor had said, but they didn't believe us and didn't call to confirm. They gave me something for the pain, but it didn't help at all. Hours passed. I was gripping the bed so tightly that the nurse had to unclench my hand. Finally, after almost 8 hours, they decided to call my doctor. Sure enough, what we'd been saying was right all along. Once they followed the original instructions, the pain finally started to ease, and I was able to go home later that night. It was one of the most painful experiences of my life, and the worst part was being treated like I was exaggerating. I've always had a high pain tolerance. I once got run over by a buggy when I was younger, but nothing compared to that night. I wouldn't wish that pain on anyone. Next story. This really happened to me. For years, I kept telling my doctor that something wasn't right. I was always tired, achy, dizzy, freezing all the time, and had constant stomach pain. But he brushed it off, saying I was just a stressed teenager. After pushing for years, I finally convinced him to run a single test, just to check circulation in my feet. He was shocked at how bad it was. That one test led to more tests, and things started to make sense. My blood work showed thyroid issues, inflammation showed arthritis at just 14 years old, and then I developed kidney stones, which he said was almost unheard of for someone my age. Over time, I learned to really pay attention to my body. When I was 16, I went back because I could feel my heart skipping beats. He didn't believe me again, but gave me a small dose of a medication just in case. The next morning, after taking it, my heart stopped. A classmate performed CPR and got it going again, and I was rushed to the hospital with extremely low blood pressure. Eventually, I was diagnosed with multiple chronic conditions, 24 in total, and I might have a genetic disorder that links them all. I'm 22 now. I still deal with pain and need help sometimes, but I've finally been referred to the specialist I've needed for years. It's frustrating to think that if I'd been taken seriously from the start, things could have been so different. At least now, my doctor actually listens. Next story. When I was an intern working in one of the busiest emergency rooms in the country, I was still pretty new and naive. One night, an older man came in complaining of severe abdominal pain. He told me that he'd been drinking and spending time with someone when he passed out, and when he woke up, he said, "I think she might have put something in there." When I examined him, I could feel a firm mass in his lower abdomen. But I honestly didn't think it was possible for someone to place an object like that without him noticing. We sent him for an X-ray, and sure enough, there was a large foreign object inside his body, a metal hanger that had been reshaped and covered in padding and fabric. I was naive enough to believe his story at first, but it quickly became clear that there was no mystery person involved. He had done it himself. Because of that lie, he went through several unnecessary tests and hours of delay before we could help him. That experience taught me an early and unforgettable lesson in medicine. People are often embarrassed about what really happened, and it's our job to stay calm, respectful, and focused on helping, no matter the story. Next story. I'm not a doctor, but this is my story about not being believed by doctors. About 6 years ago, I had my appendix removed, and during that surgery, they also discovered I had a chronic pain condition called endometriosis. Since then, I've been in and out of the emergency room with severe abdominal pain, the same kind of pain I'd had before my appendix surgery. Over the years, I went through 3 more surgeries for endometriosis and had countless scans, but nothing seemed to fix the pain. Eventually, I got labeled as drug-seeking, which was frustrating and completely untrue. Then last August, I went back to the hospital again, this time in unbearable pain, and I refused to be brushed off. A surgeon reviewed my most recent scan and noticed something everyone else had missed. The doctor who did my first appendix surgery had accidentally left a small piece of my appendix behind. I ended up needing a second appendectomy. After that surgery, the constant pain finally eased. I still have some discomfort from my chronic condition, but it's nothing like what I went through before. It's hard to believe that after so many scans and operations, no one caught it sooner. But I'm just grateful that one surgeon finally did. If that remaining piece had burst, things could have ended very differently. Next story. I work in neuro rehab, and one of my patients had a history of alcohol abuse and multiple attempts at self-harm. Her last attempt caused brain damage, which is why she ended up in my care. Because of it, she could only remember things for about 5 seconds at a time. During sessions, she would ask the same questions over and over. Things like, "Is my mom still alive? And does she come to visit me?" Then she'd forget and ask again. It was heartbreaking, but we tried to keep things gentle and consistent. One day, I was helping her with basic orientation. Things like, "What's your name? Where are we? And what do you do for work?" She got her name right, but when I asked about her job, she said, "I'm a spy, but I'm not supposed to say that." I smiled and tried to gently guide her toward something more realistic. I asked, "Do you work in an office? Are you in finance?" But no matter what I suggested, she stuck with her answer. "I'm a spy." After our session, I went to look through her file to confirm her background, and under occupation, it actually said classified. When I later asked her family about it, they told me they never really knew what she did, only that she worked for a national intelligence agency. So, yeah, I spent an entire session trying to convince my patient she wasn't a spy. And she actually was. Next story. I was about 11 when this happened. My first day of summer camp. I was goofing around with one of my friends and playfully jabbed him in the chest. Right then, I heard a pop and said, "Dude, I think I just broke my finger." He didn't believe me. And honestly, it didn't hurt much at first. So I just kept going with my day. A few hours later, it was still sore and starting to swell. So I went to the camp nurse. She said it was probably just stubbed, gave me some ice and pain medicine, and sent me on my way. I spent the rest of the day playing frisbee and football, just favoring my other hand. The next day, I went back to the nurse because it still hurt. She grabbed my finger to check it, and the pain was instant. That's when she said, "I guess we'll send you to the hospital." At the hospital, the doctor took one look and said, "Yeah, that looks broken." They did an X-ray to be sure, and sure enough, it was. So, yeah, I spent almost 36 hours thinking, it's fine, while running around with a broken finger. Next story, patient here. Back in 2011, I was about 4.5 months pregnant when I suddenly felt really sick and dizzy. Then, out of nowhere, I felt something was terribly wrong. My friend's boyfriend rushed me to the hospital. When I got there, my blood pressure was dangerously low, so low that the doctors couldn't understand how I was still conscious. After running tests, they discovered I was having an ectopic pregnancy, and I was losing blood internally. Things happened fast after that. The doctors worked tirelessly to save my life. They told me later that I had technically passed twice that night, but somehow I made it through. I lost a lot that day, including my baby girl. I had planned to name her Serena Grace. Even now, the doctors can't explain how I survived. All I know is that I did, and every day since, I've carried her memory with me. Next story. Not me, but my dad. And he's not a doctor. But this story still cracks me up every time I hear it. My dad works in construction, and one night he told me about a guy he worked with who had a really rough day on the job. They were cutting wood with an angle grinder when, out of nowhere, poof, the guy accidentally cut off 3 of his fingers. Everyone rushed to help. They managed to find 2 of the fingers and put them on ice. But the 3rd one was missing. They searched everywhere until someone spotted a cat running down the street with the missing finger in its mouth. So picture this: 4 construction workers, still in their hard hats and safety vests, sprinting up and down the street chasing a cat. All for one poor guy's finger. I know it shouldn't be funny, but just imagining that scene gets me every time. Next story. Patient here, not a doctor. It's not the wildest story, but it definitely stuck with me. From around age 19 to 23, I kept having random, intense bouts of nausea and abdominal pain. My doctor first thought it might be gluten intolerance, so I cut out gluten. But it kept happening. Then he suggested lactose intolerance, so I cut out dairy too. Still no change. After a while, I started researching on my own and began to suspect it might be my gallbladder. When I brought it up, my doctor dismissed it right away and said it was probably just a stomach virus. He'd already done some tests and ruled out ulcers, so he didn't think there was anything more to check. But the pain wouldn't go away, so I pushed to get an ultrasound, and sure enough, there they were. Gallstones. Recurring ones, by the look of it. Turns out, I'd probably been dealing with them for years. Next story. Not quite the same as the other stories here, but this one still blows my mind. When I was about 15, I went in for a regular physical. The doctor started asking the usual questions, things like, "Are you sexually active? And do you smoke?" I'd never been asked those kinds of questions before, so I hesitated for a second, trying to think of what to say. After maybe 2 seconds, the doctor snapped, "It shouldn't take you that long to answer a question." I remember thinking how rude and uncomfortable that was. When I got home, I told my mom I didn't want to go back to him. Fast forward a few years later, I see the same doctor on the news. He'd been charged with serious misconduct involving some of his patients. Apparently, he'd been behaving inappropriately during exams and had several complaints filed against him. It was shocking to see his face on TV, but honestly, after how strange that appointment felt, I wasn't completely surprised. Next story. Not exactly what you asked for, but here's one of those doctors couldn't figure it out stories that still makes me laugh. I was living in Ecuador for about a year and a half, and one day after playing soccer, I noticed I was walking funny, super flat-footed, like I was stomping with every step. Later, I looked down at my feet and realized I couldn't lift my right foot at all. That didn't seem right, so I went straight to the ER. They took an X-ray of my foot and told me nothing was broken, probably just inflammation, and gave me some medication. But I wasn't convinced. A few days later, I went back. This time, they took an X-ray of my leg and even did an ultrasound. But again, they told me it was just inflammation. At that point, I decided to head back home to the US to see my own doctors. An orthopedic surgeon checked me out and said nothing seemed torn or broken, but recommended I see a neurologist. 3 weeks later, the nerve test showed that my perineal nerve wasn't working quite right. Something was blocking it. They sent me to physical therapy to try to help it heal. One day during PT, the head therapist got this curious look on his face and started feeling around my knee. After a few minutes, he called the other therapists over. Turns out my fibula, that smaller bone in the lower leg, had slipped out of place and was pressing on the nerve, which caused my foot drop. They carefully reset it, And within a week, my strength and movement came back almost completely. My PT said he'd only seen something like that one other time, but never bad enough to cause nerve blockage. So, yeah, after months of, "It's just inflammation," it turned out my entire fibula was out of place. Close enough, right?